The third wave of COVID-19 in South Korea seems to be on an overall downtrend, but there was a slight bump on Wednesday compared to the previous day. However, some good news may be on the horizon in efforts to get life back to a semblance of normalcy, as the government could soon give emergency use approval to a local biotech firm for its virus treatment. Seong-woo with the details.
South Korea reported 562 new COVID-19 cases on Wednesday. 536 of the new infections were locally transmitted, and over 350 of them came from Seoul and the surrounding area. With cluster infections at nursing homes and churches still threatening public safety, the total tally has now surpassed 70,000, less than 2 weeks after hitting the 60,000 mark. 20 more fatalities have pushed the death toll up to 1,185. Meanwhile, the National Health Insurance Service has announced it will claim indemnities from the BTJ Center for All Nations, a missionary facility in Gyeongsang-buk-do province reportedly responsible for close to 600 infections so far. The center has been accused of disrupting virus prevention measures by refusing epidemiological investigations.
We will have to limit the scale of the pandemic as much as possible until February, when vaccination and the introduction of treatments can begin step by step. Only then can prevention measures be carefully eased for industries that have been severely damaged.
South Korea plans to inoculate healthy adults aged 19 to 49 starting in the third quarter of 2021. They will be given shots after those designated as priority recommendation groups have received their vaccines. The Central Disease Control Headquarters said on Tuesday that it is pushing to inoculate the population and achieve herd immunity as fast as possible. Hopes are high for the development of treatments as well. Korean biopharmaceutical firm Celtrion is scheduled to disclose its COVID-19 antibody therapies Phase 2 clinical trial results on Wednesday evening. Called Recurona, the treatment currently awaits emergency use authorization from the Ministry of Food and Drug Safety. Seong-woo, Arirang News.